Joining us in our newsroom virtually is Dr. Joseph Murad. He is an orthopedic surgeon at Methodist Sports Medicine, here to talk about elective surgery. So welcome, Dr. Murad.
Hi, Mary. Thanks for having me on your show.
So we're talking about elective surgery in the time of this pandemic, and we know it was necessary to delay elective surgeries because we needed hospital beds. We wanted to put these patients, these elective surgeries off, to not put anyone's safety at risk. However, such as elective surgeries, such as hip and knee replacements, which I understand is your specialty, they can progress rather quickly. So can you speak to this? How might this have affected a person's quality of life who is in need of these surgeries, and if delaying the surgery could complicate the surgery?
March, when we didn't know what was happening with the progression of the virus, it was definitely the right thing to do to pause elective surgery to conserve medical equipment. And yeah, we've resumed elective surgery now, and we're doing it as safely as possible by doing things like COVID tests ahead of surgery and quarantines ahead of surgery. The thing about hip and knee replacement and a lot of elective surgery is that by the time someone chooses to have elective surgery, they've done everything they can to avoid that elective surgery. They've exhausted all the treatment measures. And so by the time someone chooses these elective surgeries, it may not feel that. As far as increasing the complexity of the procedure, sometimes it can increase the procedure complexity, but most of the time it'll still result in the same operation.
And during the time of COVID-19, how many surgeries or how many appointments were put off, delayed? How many patients missed appointments due to the pandemic?
You know, we tried to stay as accessible for patients as possible. We were seeing, hundreds of patients a day, over 300 patients a day in the office. And some of those patients need to be seen even during the pandemic. So we switched quickly to having telehealth appointments available, not just to see all of the post-op patients that we had just operated on back, but to remain accessible to patients with new musculoskeletal injuries or patients whose pain from chronic medical condition had worsened.
And it's not only about the surgery, but like you also said, the follow-up appointments. So now that we have, you guys are open, almost fully functioning, I imagine, can you reassure patients who are still hesitant to come in for follow-up appointments? Follow-up appointments are really necessary. It's not just the surgery and you're done.
Contact with patients who had surgery and needed follow-up appointments. Most of those patients had their follow-up appointments done already over telehealth. And when we were back in the office, we had them come back in to obtain things like x-rays to make sure that things were okay, even if they were feeling well. So we were definitely able to deliver the healthcare that our patients needed. And at this point, if you have a new condition that needs care, we're certainly available to you, whether in the office or through telehealth.
And just a question, in your opinion, I think of this a lot. How do we objectively define elective surgery? I mean, not in terms of hip replacement and knee replacement, that can really affect someone's quality of life. We know chronic pain is associated with suicide, but I also think of maybe a woman getting a mastectomy, and it's sort of, is that elective? I know it's not your area of expertise, but just sort of, it raises a question of how do we differentiate between the two?
But to just touch on some of the things you mentioned, something like a mastectomy for cancer, even though it's not my area of expertise, cancer surgery, depending on the type especially, is probably not elective. And those type of surgeries proceed.
I'm sorry, I'm sorry, I didn't mean to interrupt you. I meant reconstructive surgery. It's affecting maybe their mental health. That is my fault. Electives, is that, the question is, it's affecting a woman's life, and I know it's not your expertise if you don't not feel comfortable answering that question, but it just raises the question to me, even in terms of hip and knee replacement, it affects the quality of life and chronic pain, and that could be dangerous for some individuals who are not in maybe a mental state to begin with.
During this pandemic, about access to mental health services. Chronic pain is very difficult to deal with, and that's what a lot of the operations that we do address. Elective surgery is, when you're dealing with things like hip and knee replacement, it falls into this very gray area, and it's just about minimizing the risk to the patient. It's doing these surgeries where we have very good outcomes in an environment where it's safe to do it. And we had to take a pause for it for a while we figured out how to do it safely in the setting of this pandemic. We have. One of the interesting things that we saw recently was the positivity rate in the tests that are done pre-surgery to make sure that patients don't go into surgery with COVID. And those rates are very, very low. And when they come back positive, we delay surgery. We retest those patients and bring them to the hospital safely, making it as safe as possible for both those patients and all of the patients and staff in the hospital.
Okay, well, Dr. Murat, we'll leave it there. Thank you so much for your time.
Yeah, of course. Thanks for having me.